Thanks, Janice. Good evening, everyone. I'm Michael Leitman. I'm a professor of surgery, and I'm the Senior Associate Dean for Graduate Medical Education at Mount Sinai. GME, as we call it, is the education of residents and fellows after medical school before the entry into practice. And I'm here to talk about burnout. It's kind of what happens after fatigue is around for a while. Burnout is emotional exhaustion, depersonalization, and a lack of a feeling of personal accomplishment. Burnout is prevalent. 45% of medical students have burnout, even before they've become physicians. Our residents, we did a survey last year, 52% of our residents at Mount Sinai, and Mount Sinai is no different than any other teaching hospital in the country, 52% of our residents have signs of burnout from a standardized survey. It seems to be correlated with work intensity, so the number of patients that they care for, the number of hours they work per week seems to correlate with the amount of burnout. And burnout occurs, and don't worry about the fine print here, in all specialties. It's not related to the intensity of the type of work that we do, so a neurosurgeon isn't any more likely to have a burnout than a pediatrician, but it's prevalent in all specialties. Burnout leads to depression, and there's actually a great prevalence of depression amongst residents with burnout, and unfortunately burnout leads to suicide. And physician suicide is a terrible problem in this country. Physicians are more likely to commit suicide than almost any other gender or age-matched group. And so you have a lot of things that contribute to burnout, and then burnout also causes problems with poor academic performance. I mentioned suicide also impacts on patient care. And so 400 physicians every year commit suicide. The incidence of physician suicide is between 1.4 and 2.3 times higher than the general population. And so we're looking to all of you to help us develop solutions to physician burnout. As already been mentioned, we're looking at ideas for a smartphone or wearable technology to measure biofeedback, real-time stress. We're looking at application-based measurement and mitigation techniques for physician burnout, resilience training, narrative medicine, emotional intelligence, mindfulness training, some of the things that we're happy to explore with you. And I look forward to working with you. Thank you.